Good morning, everyone. And thank you so much for joining us today for the launch of the Disability Inclusion in Disaster Risk Management Assessment in the Caribbean. So this is a report commissioned under the Canada Caribbean Resilience Facility, which is a trust fund financed by the Government of Canada and hosted here at the World Bank at the Global Facility for Disaster Reduction and Recovery. So I'm Zoe Trohanis. I'm a lead disaster risk management specialist here at GFDRR, and I'm leading our inclusive disaster risk management and gender equality initiative at the facility. And I'm really excited to be here to moderate this event with everyone. So just to give you a quick idea of the agenda, so we'll have some short opening remarks, and then we will have a presentation of the findings of the report by the author with some reflections. And then we will shift to our distinguished panel for a conversation about how we can really pave the way towards disability inclusive disaster risk management in the Caribbean. And then of course, questions and answers. So please, this is supposed to be an engaging session. So please put any questions, comments you may have in the chat box at the bottom right of your screen. And so we'll do our best to answer as many as we can. So I'd like to hand the floor over to Niels Holm Nielsen, who is the practice manager here at GFDRR, to kick us off with a few opening remarks. Niels?
Thank you, Zoe. And good morning, everyone, from me as well. And thanks a lot to all of you for joining us this morning for the launch. So I am Niels Holm Nielsen, as Zoe mentioned. I'm the practice manager for the Global Facility for Disaster Reduction and Recovery. I guess my role here this morning is, I'll only be very brief, but I do think it's important that you all hear a managerial, World Bank and Global Facility voice on this agenda, to stress the importance that it has for our facility and I believe for our institution to put a specific focus on disability in the context of disaster risk management. And as the report contributes to us all trying to learn how far we have made it, but also identify the road that we still need to try to travel together. So let me first thank Canada, of course, for their continued partnership on this very important agenda. As Zoe mentioned, the report was financed by the Canada Caribbean Resilience Facility, a trust fund that we manage at the GFDRR, and supports 9 Caribbean countries to achieve more inclusive, climate resilient preparedness, recovery, and public finance management practices. The report is a second in the series of regional assessments aimed at helping us better understand the unique characteristics and gaps which may exist in the Caribbean on DRM policies and programs. It's also part of a larger body of work that we are undertaking at the World Bank and GFDRR on inclusive disaster risk management, an agenda that Zoe referred to and that she's leading. This is an important area of work for us because various groups within populations experience disaster differently. And therefore, building resilience in our communities is not a one-size-fits-all. And we know that some segments of society, including often women, the poor, the elderly, and persons living with disabilities, are more susceptible to the impacts of disasters on account of pre-existing social, economic, and political factors. So it's therefore important to meaningfully include their voices in the planning and implementation of strategies to support their different needs. I think many countries that we work in globally still do not take disability much into account in their disaster risk management. In a sense, the Caribbean is therefore ways ahead of many. However, often managing disaster risk in the Caribbean have been done for persons with disabilities and not with them, as this assessment report has showed. The report argues that this is because of stigma and attitudes towards persons living with disability, that they are helpless, and also because of failure to create the space for them to fully and meaningfully participate in the conversation. This could, for instance, be physical barriers, such as the absence of wheelchair ramps, or communication barriers, like not being able to provide sign language translation. There's also issues around countries not fully implementing policies where those policies do exist. So it's clear from the findings that additional efforts are required also in the Caribbean. The physical, legal, and social barriers that exclude people with disabilities ought to be removed. And with the current trajectory towards more and worse disasters that I think we are all aware of and experience today, we need to be aware of these realities, highlight the challenges, and address these issues. And the assessment and our work under the facility of GFGRI is, of course, only a small part of this. Today's event will shed some light on these issues, but also hopefully create a platform for conversation that will move the needle more on this topic. And before I hand it back to Zoe, let me thank today's speakers and panelists, as well as all of those who have connected to be part of the conversation. Thank you very much. And back to you, Zoe.
Great, thank you, Niels. So now I would like to invite Dennis Boszkowski, who's a senior country officer for OECS countries here at the World Bank in the Latin American Caribbean region, to say a few words. Dennis?
Thank you very much, Zoe. It's really a pleasure to be here today at the launch of this important report. Let me first join Niels in thanking the Canadian government for the continuous support to the Caribbean region, and also thank all the excellent speakers and panelists for their presence today. Being able to witness the effects of the different hazards by working with these countries directly, I can say that they're devastating. The Caribbean region is highly exposed to them, and the annual losses often exceed 17% of their GDP on average. Disasters affect hundreds of thousands of people every year. Because of the size of the country, they affect always the whole country. Now in the Caribbean region, there are approximately 1.3 million people living with some form of disability. And nearly 250,000 of them are significantly functionally limited. And as mentioned by Niels, persons living with disabilities are more susceptible to the devastating impact of disasters. People with disabilities have 2 to 4 times higher rates of mortality from disasters than average. And this is due to, as Niels pointed out, due to less access to information, less support, and less access to resources. Also, even more importantly, they're often excluded from conversations where important decisions are made. So, it is important that we improve our understanding on disability inclusion and in disaster risk management. We need to support countries to close the gap, and in doing so, hopefully break stigmas and change attitudes to include persons with disability in open discussions to plan for a more resilient region. Going in that direction, this report is highlighting the relationships between climate change, hazards, disasters, and social and disability inclusion in the region. It discusses the demographics of persons with disability and legal frameworks, and more importantly, provides concrete recommendations to countries to close the gaps I mentioned before. Let me close by saying that the World Bank remains committed to continue supporting an inclusive approach to building resilience in the Caribbean region. And I'm happy to see this meeting taking place and such a good set of panelists and speakers joining it. Thank you for inviting me.
Thank you, Dennis. So without further ado, after those nice opening remarks from our colleagues, I'd like to now invite Dr. Linda Anderson-Barry, who is an inclusion specialist and the author of the report, to give us an overview and a presentation of the findings. Linda?
Good morning, and thank you everybody for being here. This presentation opens with a brief discussion of the objectives of the report of why disability inclusion in disaster risk management and climate resilience is important. Then we'll move into presenting the findings, the main findings of a desktop study that's identified the significant gaps in current processes that result in barriers to access for information and to the built environment for persons with disabilities, and the impact this has on their ability to fully participate in disaster risk management. And finally, there's a summary of the report's 16 recommendations that are designed to reduce or remove accessibility barriers, and this is presented for review and to open up the panel discussion. The objective of the work primarily was to understand, examine and explain disability exclusion gaps in disaster risk reduction, resilience and climate resilience in the 9 eligible CRF countries, and then propose recommendations to make preparedness and recovery more exclusive of persons with disabilities. In doing this, we considered national disability demographics, data availability, particularly disaggregated disability data for planning and post-disaster needs. We looked at the extent to which different types of disability are taken into account in disaster risk reduction and early warning systems, and the accessibility barriers and the existence of policy and social safety nets in both the societal context and the disaster context, and then the extent to which recovery and reconstruction projects prioritise accessibility for persons with disabilities. And this goes to mainstreaming disability in development. Now, as has already been mentioned by both previous speakers, that disability inclusion in disaster risk management matters. We know that populations with low levels of societal resilience, there's greater opportunities for hazards to become disasters, and that people with disabilities are impacted and suffer loss disproportionately at greater scales than the general population. But we also know that supporting and building resilience amongst persons with disabilities greatly increases societal resilience generally. Disability inclusion is based on understanding the relationship between the way people function and how they participate in society, and making sure that everybody has the same opportunities to participate in every aspect of life to the best of their abilities. So basically, this is about ensuring that people with disabilities have choice to take defensive actions and creating opportunities to build their resilience. Now, the main findings of the report around the disability demographics are that officially prevalence varies between 3.5% and 11% of the national populations. Now, this is the official figures, but the reality is likely to be that it's much closer to 15% of the population. Vision impairment and mobility impairment have the highest prevalence overall, and marginally high numbers amongst females across all categories and age groups. Mental, intellectual and psychological disability are poorly understood, supported and managed. As has already been mentioned, there's a high level of coincidence of disability and other marginalising demographics, and this magnifies limitations. And disability increases with age, both in prevalence and degree, and all Caribbean populations are ageing. And this is consistent with international trends as well. Now, all the Caribbean countries have adopted to some extent the internationally accepted Washington Group's definition of disability based on function and consequent limitations, and this enables better metrics and data management. And when the Washington Group's set of questions are applied to national census and national surveys, it'll allow more consistency in both data collection and in understanding the demographics. All countries in the Caribbean have a signatory to the United Nations Convention for the Rights of Persons with Disabilities, the Sendai Framework for Disaster Risk Reduction, the Paris Agreement, the Sustainable Development Goals, and a range of other international and regional agreements. They all have some constitutional protections or disability legislation or national policy supporting persons with disabilities. This is usually spread over several ministries. They have disaster risk management policy and operational practices that are based on the SEDEMA-supported comprehensive disaster risk management model, which is socially inclusive. And there's a high level of willingness for disability inclusion amongst disaster risk managers. Weather services are upgrading to impact-based forecasting and warning services. They have the option of using the Common Alerting Protocol with increased options for accessibility to communications. They are all implementing national climate adaptation strategies that have a clear focus on resilience, and social inclusion is articulated as a priority, although the process is not well described. They have enshrined building codes and regulations, communications, codes of practice and standards, etc. And importantly, very importantly, they all have a well-organised national umbrella disability representative organisation that's trusted by their membership and represents persons with disabilities in disaster risk management planning. So overall, the legal and normative frameworks that support disability inclusion in disaster risk reduction and climate resilience are established. However, simply having the policy and the frameworks in place does not guarantee inclusion. There are numerous barriers to access to participation in DRM processes, information in the built environment, and these persist for people with disabilities. Building codes and planning regulations are poorly applied, monitored or enforced. This limits access to buildings for public meetings and evacuation, and public roads, pavements and public transport. Web accessibility standards to a minimum standard of WCAG 2.0 are poorly adhered to, and this limits access to web-based information. New and emerging communications technologies with built-in accessibility functions are more available, and internet and smartphone usage is increasing. But these devices are expensive, they're often complicated, and access to networks is often difficult. And participation in policy and planning processes is often invited, but it's not well facilitated. So attitudes towards persons with disabilities as being helpless and stigma both overtly and covertly drive how the policies are applied and the place of people with disabilities in their societies. The COVID-19 impacts have been interesting. In some ways, they've highlighted persons with disabilities as being at greater disadvantage and increased the awareness of their needs for support. But throughout this period, there's been an increased difficulty in actually accessing reliable information, reliable in-country information. The disability support organisations have become more active, and there's been greater levels of interaction with governments. National disability registers that are going to be extremely useful for disaster risk management planning are being processed or progressed as a higher priority in several countries. And there's been an increased development in the use of accessible communications technologies. Now, the report has 16 recommendations that separately and collectively work with delivering 3 targeted key areas. This is improving data availability and management, removing or reducing the physical and social barriers to access to information, the built environment, and participation in disaster risk reduction planning processes, and building awareness of the capacities and abilities of persons with disabilities, and eliminating stigma. These recommendations collectively will support all 3 areas, but recommendations 1, 2, 3, 4, and 5 aim to understand and define data needs across the disaster management sector, establish agreed data collection and management standards and data sharing protocols that ensure appropriate accessibility. Recommendations 6, 8, 10, 11, 12, 13, 14, 15 and 16 consider addressing gaps in legislation supporting accessibility standards, enforcing existing instruments and implementing new strategies to reduce accessibility barriers. And recommendations 7 and 9 support strengthening relationships between disaster risk managers and persons with disabilities and organisations representing them, and raising awareness of the capabilities and capacities of the persons with disabilities and reducing stigma. Many of these recommendations address to some extent all three of the key areas. So that was just a very brief overview, and I'm happy to take any questions. But I would like, it's already been mentioned, but I really sincerely would like to thank the World Bank and the CRF for the opportunity to do this report and prepare this work, and for their ongoing commitment to disability inclusive disaster risk management and building societal resilience to the impacts of climate change. The impacts to climate change are going to be significant. They are significant now. They're going to be increasingly significant, and very many projects have inclusive development or disability inclusion as a priority, but not many of them commit the resources and the energy to actually delivering this. I'd also like to thank the CRF team for their support in getting this work done. So thank you.
No, thank you very much, Dr. Anderson-Berry, for the presentation. So I'd actually now like to invite Maria Elena Garcia Mora, who's a senior social development specialist here at the World Bank in the Latin American Caribbean region, just to give us some reflections before we start launching the panel discussion. Maria Elena?
Thank you so much, Zoe. And I will start first with a short physical description for those that might be in the audience with visual disabilities. So I'm a Latin woman with dark brown hair and green eyes, and I have some green earrings. And first, I would like to congratulate Dr. Anderson-Berry for a fantastic report. The report covers an important knowledge gap in a very clear and systematic way, offering practical recommendations on the way forward. So I think this will be extremely useful for our portfolio and for our clients. Building on Linda's wonderful presentation, I would like to focus on 7 key reflections. The first one is the assessment from the get-go establishes its recognition of a collective and systematic exclusion of persons with disabilities. It resonates with the data that we see in the region. Thinking of the LAC region as a whole, in all countries with available data except in Chile, there is a higher incidence of monetary poverty in households with persons with disabilities. 7 out of 10 households with disabilities are vulnerable to falling back into poverty. So this increases greatly any impacts that disasters could have on households with persons with disabilities. This holds true even after accounting for differences regarding to the place of residence, whether they live in urban or rural areas, the characteristics of the household head, whether we're talking about a woman or a man, the educational attainment, age, or the number of children. So this tells us that if we have 2 households that have exactly the same characteristics, but the only difference is that one has a person with a disability, there is a large unexplained gap in poverty and vulnerability that can be attributed to exclusion of disability itself. The second part is that the report, and it's what Linda was just telling us, it highlights that the 9 countries assessed have to one extent or the other disability inclusive legislation. And the report does a fantastic job at really going in depth and explaining what are the changes that are still necessary at the policy level. Yet, and most importantly, the implementation of those existing norms and tackling stigma is the other part that will be quite important. And it talks about public will, really emphasizing that it is not only a responsibility of policymakers, but it goes beyond as a collective responsibility for society's resilience. The third message is that it recognizes that some persons with disabilities are more vulnerable than others. And the assessment does so in 2 different ways. On one part, it talks about overlapping disadvantages and recognizes that race, ethnicity, and gender can act as multipliers of exclusion. But it also underscores that persons with psychosocial disabilities are rarely properly identified, let alone targeted in public policy. We still see stigmatizing language in questionnaires, household questionnaires, which of course impacts any exercise on data collection. We see stigmatizing language in daily interactions. And we have really poor understanding of the specific challenges and needs of this subgroup, which has implications for our policy making in DRR and beyond. The next part, and Linda also touched upon that, is that data is a major constraint. We have seen important progress over the last decades in our region. In the 80s, we only had 4 out of 30 countries that included a question on disability in the national censuses. 30 years later, we had that 24 countries do so. So we have seen quite a big improvement, but as the report highlights, there are quite a lot of issues related to comparability. The Washington group short set of questions are not necessarily followed fully. We see stigmatizing, and one part that I think the assessment highlights as well is issues related to lack of training and lack of awareness for enumerators and administrative staff as well. The report again does a fantastic job at drilling down some very practical recommendations for short and medium-term goals of how can we improve data in the DRM scheme. It also recognizes the critical role of organizations of persons with disabilities and the importance of strengthening voice and participation. Niels mentioned that as well as part of his opening remarks in thinking about how meaningfully we can increase their voice. And I think the report as well focuses strongly on how to go beyond passive beneficiaries to really active participants in public and policy making. And there it's also a call for us in our institution to continue working with the bank's convening power and utilizing the environmental and social framework to strengthen our portfolio. The sixth issue is that the assessment highlights how disabilities being a cross-cutting issue could lead to its invisibility by having ministerial responsibility of policy relating to persons with disabilities scattered across many different portfolios. So without a very clear benchmark on what success would look for a disability inclusion aspect. And this would be something to call upon, particularly in issues of how to measure, for instance, accessibility. And lastly, I would like to amplify one key message that Linda as well reflected as part of her presentation, and is that building resilience for persons with disabilities will lead to stronger resilience for all, something to think back as we're continue working on building back better. Again, congratulations to Linda and the team for a fantastic report. Thank you.
Many thanks, Maria Elena, for those words. So with that introduction and the reflections, the review of the presentation by Linda in terms of the content of the report, what I'd like to do now is turn to our panel of experts. So if everybody can please turn your cameras on if you're able. I'd like to introduce the panel first. And just to mention, unfortunately, one of our panelists had an emergency and couldn't join today. That's Charlotte McLean Napo, who was our Global Disability Advisor. So we'll miss her. But we, of course, still have our other fantastic panelists. So we have Colin Alt, who's Commissioner for the Guyana National Commission on Disability. Welcome, Colin. And we also have Liz Riley with us, who's the Executive Director of the Caribbean Disaster Emergency Management Agency, CDEMA. Hi, Liz. And we have Michelle Forbes, who is the Director of the National Emergency Management Organization for St. Vincent and the Grenadines. So maybe to kick things off, Liz, I'll start with you if that's okay. So in a few minutes, if you could tell us a bit, CDEMA has been a key partner for GFDRR, the CRF, and of course, governments in the Caribbean. So what do you think are the main barriers to achieve disability inclusive disaster risk management? And what is CDEMA doing? What actions is CDEMA taking to help members overcome these barriers or bottlenecks?
Thank you very much, Zoe, and allow me to say good morning to my fellow panelists and all who have joined us. I want to add my voice to saying congratulations to the GFDRR and the Canada Caribbean Resilience Facility on the launch of this report. And I have to say it was very instructive reading through, and we really appreciate the opportunity for CDEMA to contribute. So in terms of context, I want to start by saying that the identification of treatment of vulnerable populations within the Comprehensive Disaster Management Strategy 2014 to 2024, and also the identification of social protection for the marginal and most vulnerable in our populations as a pillar of the Caribbean Resilience Framework that was adopted in 2018 is very much intentional. We are very much seized of the fact as SEDIMA that disasters impact persons differently. We have irrefutable evidence that disasters have particularly damaging effects on the most vulnerable in our communities. And we also know that vulnerable persons, including those with disabilities, are likely to be affected to a greater degree. So these are things that have been proven statistically. So in terms of the main barriers to disability inclusive DRM in the Caribbean, I probably will speak to three, and it is going to very much mirror what is said in the report. And first, I very much agree with the observation of the report that disability is poorly defined. And there's definitely a need to have a more robust disaggregation of that collective term, because we recognize that different types of disability have different types of required treatment within the whole DRM conversation. I think second is to reiterate the point which has been raised on the evidence base to inform policy making and decision making. So I noted within the report that it spoke to the statistics on the officially reported prevalence of persons with disabilities as a proportion of national populations in the Caribbean. I saw that there was quite a diverse range from 2.5 to 7.3%, which I thought was quite interesting. And I wondered to what extent those statistics are a true reflection of what is happening on the ground. And I think what also struck me was the point that disability increases both in prevalence and intensity with age, and the fact that the demographic profiles of the Caribbean are more and more trending, and in fact, in some countries already there towards aging populations. And of course, the third point is related to the realities of where we're at with respect to social inclusion and the access to opportunities to participate. So I think the report was very much on the mark in terms of the barriers. Now, from this SEDIMA system perspective, and I say system because we include the coordinating unit, but also our 20 participating states, of which St. Vincent and the Grenadines, of course, is one. And I'm happy to see Ms. Forbes here, given that national perspective. I realize that in reflecting on the work that we have done, we have given some treatment to this issue, but I think there's definitely a space for us to do a lot more. So at the strategic level, I mentioned previously the CDM strategy or the resilience framework, and the principles of social inclusion are there because it very much articulates the importance of looking at vulnerable populations and giving due consideration, but it is not explicit as it relates to persons with disabilities. And we do have an opportunity this year with the review of the regional CDM strategy. In fact, we're just about to start that process. So I'm glad that this conversation comes at this juncture because it gives us an opportunity to make that implicit understanding much more explicit. I think on the area of the social inclusion, there are spaces within the work that SEDIMA has done to give space and voice to the issue of treatment of persons with disabilities. So we have our model documentation that's been prepared. I see that it was extensively reviewed and referenced in the report, so thanks very much for that. But we do there give spaces for a seat at the table for organizations which speak specifically and treat specifically issues of persons with disabilities. There's also within other policy, legislation, and guidance documents within the coordinating unit suite, which gives specific treatment to persons with disabilities. And I think most recently, we did a revision, for example, of our shelter management guide. And I know that there is an explicit treatment there. In fact, it's going to our technical advisory committee today, this year in April for review. I think also the area of emergency response, because, and this is the final point I'll make, because we have been working in a very deliberate way to expand the curriculum for training, particularly of deployment teams. And we have integrated specific modules of those trainings, for example, for our CARICOM disaster relief unit, to look at vulnerable groups. We've got support, for example, from UN Women, from UNICEF, and I think we have an opportunity there as well to perhaps integrate a specific module looking at persons who live with disabilities. So thanks again for the opportunity to make the contribution. As I said, we are doing some things at the coordinating unit, but I do think there's a space for more. And I very much look forward to the exchange following the panel presentation. Over.
Oh, thank you so much, Liz. Really interesting to hear what actions, concrete actions that SEDIMA is taking in line with the report findings. So that's exciting. Okay, so I'd like to move on to Michelle. So Michelle, what are some of the challenges faced in making disaster risk management efforts in St. Vincent and the Grenadines more inclusive? And so what could you tell us maybe a couple of top lessons learned from your efforts, what you've seen on the ground? That would be great.
Okay, good morning, everyone, and thank you for having us representing on this panel this morning, and thanks to the GFDRR and the Canadian Caribbean Resilience Facility for the report that you have put forward, which really clearly demonstrates, or basically the report is showing some of the similarities that we have seen in St. Vincent and the Grenadines, especially in the last 10 to 15 years when we're dealing with disaster risk management. Some of the challenges that we have encountered in terms of persons with disabilities, of what we sometimes call very important persons, is the whole issue of identification. And this mentioned it there, I was smiling a bit, identification of who are these people, knowing where they are and the differentiation in the disabilities. And I said this in the context of coming out of the volcanic eruption last year, we would have attempted to map, or attempt to map where the persons with disabilities were in the event that they had to be evacuated. And it was a bit of a challenge getting those categories, who they are, whether there's a mental challenge, whether there's a psychosocial issue, whether there's physical, physical mobility issues. And having that index or that list of persons, knowing where they are and whether they would need assistance, it can prove quite a bit of a challenge. What we have seen over the years too is that many of the buildings or the structures, especially the public buildings, are not suitable or do not have access to persons with disabilities. From where we sit at the National Emergency Management Organization, in all of our work, in any reconstruction that we are doing, especially for emergency shelters, we have insisted that you must have ramp facilities, we must have bathroom access for persons with disabilities. And this have been done in the newer buildings, but we are seeing the older buildings are not meeting that new code in terms of retrofitting for persons with disabilities and even the information. Now, we're still battling with the whole stigma of persons with disabilities, and we saw that happening last year, where we had persons being abandoned. We had a volcanic eruption, evacuation order given, and the persons were left at home. The family evacuated and left them at home, or they abandoned them in the shelter. So that whole stigma, they do not want to deal with the persons with disabilities, their own family. And we still have a culture where persons are hidden. If you whether you have Down syndrome, whether you have other disability, learning disability, you're still hidden at home. And I quite recall in the 80s, going to school in the 80s, you would see persons at the school for children with the special needs, that's what's called in St. Vincent. But there was a large population still at home, especially in the rural community, who have never had the access to sign language, never had the access to the reading of the Braille, etc. And so we still have a large population of the disabled that we cannot communicate with. And that's a big challenge, even though we try to do some sign language within our public information education. It's not enough because we are not doing that enough information that can reach the wide cross section of the population that have some disabilities. The legal framework, I know we have done some updates in terms of legal framework to deal with the persons with disability, but I would like to say go further. How do we treat persons who have been abandoned, abused by their family members, by the society? Is there going to be a mandate for the families to take care of these of the elderly in particular? Because we are seeing a trend in the region and in St. Vincent where the elderly, especially the elderly men, are being abandoned by their families because of our social constructs in terms of how they interact and relationships with their children and women, and they're being abandoned. And then, of course, the state is being left with that responsibility to take care of them. So how can our legal framework address some of these issues and some of the challenges that we are seeing here in St. Vincent? In terms of lessons being learned, what we have learned is that it must be inclusive. You must have persons with disabilities being included in the discussion. The mapping of the persons going to help us to be able to say who is where and who is where, and it must be done at the local level and at the family level. Because where we sit at the national level, we have no clue who may be disabled in a particular community. We may just have numbers, but in terms of that mapping and that inclusion right down to the community and family level must be a must. They must be included in your planning for emergencies, in your evacuation planning, knowing what to do, and the families and his community have to be empowered in knowing how do you address and take care of the persons with the elderly persons and those with disability that may need to move because they're often vulnerable. Their conditions of living are very, very poor sometimes, even though that they get some assistance. Sometimes it's being abused or they're being ripped off by their family members. So those we have to go down to the local level to see really what is happening at the family and the community level. One of the lessons learned, we have to make arrangements for those persons with disabilities who may not have access to certain resources. And I want to give an example of what we had to do last year following the volcanic eruption. We had to actually set up an emergency shelter to deal with what we call a very important persons. We call them VIPs. We didn't want to say persons with disabilities to give them a tag name. We said the VIP shelter, where we had a lot of elderly persons with mobility issues, persons who were abandoned. And we had over 80-something persons, as a matter of fact, in the peak of the emergency that were abandoned. It's dwindled now. Unfortunately, the state now has to continue to deal with, to take care of these persons. We actually had to activate another emergency shelter just to cater for the needs of this population. And we now have to build another facility to cater for those people who have been abandoned. The VIPs really means very important persons. We don't want, somebody asked the question, I'm saying it there. So basically, we treat them special as if they're VIPs. We say in the Caribbean, we treat them special. So the arrangements have to be different. We cannot treat the persons with disabilities have different needs, have different psychosocial needs, the feeling of abandonment. They need to feel included within the whole context of how we deal with persons who have been impacted, especially from emergencies. So these are some of the challenges that we face, and these are some of the lessons learned that I think we have experienced over the years.
Thank you so much, Michelle, for those reflections. Really interesting and tangible points, I think. And so we've got some discussions heating up in the chat, which we will come to, but I'd like to move on to our last panelist, Colin Alt. Colin, if I can invite you, I see you there. So Colin, we heard from Linda earlier that there is a clear commitment and willingness from Caribbean governments to achieve disability inclusive disaster risk management. But of course, barriers to full and equal participation in policy discussions and operational planning persist. So from your perspective, what key progress is necessary? What do you think is necessary to support the full engagement of persons with disabilities and enhance disability inclusive disaster risk management in the Caribbean? And then from your perspective, what has worked well and what maybe hasn't worked based on your experience in Guyana?
All right. Thanks for having me on the panel. And I am very much impressed with the comprehensiveness of the reports given so far. And to address the question, what is needed to have people with disabilities involved, more involved. Communication is a big issue because the communication must be affordable, reliable, and accessible. And this becomes very difficult in the rural areas and the interland areas, what we call the interior areas, and then out in the savannas of the Rupununi. Communication needs to be improved. And that communication must take into consideration people of various disabilities, the blind, the deaf, the intellectually challenged, the people with psychosocial problems. So communication is something I have listed here as very, very important if people are to be included, people with disabilities. Then the need for a database. So we must know where people with disabilities are. We must also know the nature of the various disabilities. And then I have advocacy. We still have things rooted in the culture that socialize people with disabilities as, under generational curse. They're punishing for the sins of somebody else. And these people, somebody made a statement that we must not only be passive beneficiaries, but we must be active participants. And the society needs to know that people with disabilities can participate effectively in the major decision processes of the country. And education is involved here too. Education in terms of the inclusion. Up to, like, let's say 15 years back or so, people with disabilities were like sidelined, marginalized when it comes to education, but there is some level of improvement with that, in that regard. We have blind persons at the University of Guyana, but we'd like to see other groups, especially from the Society of the Deaf, being involved, in improving their literacy skills, so that when communication is given, they can really access this communication quite easily. With reference to evacuation, it must be understood that Guyana is prone to flooding. Our 270 miles coastal strip is prone to flooding during the rainy season, and also during the hurricane season. You could get high winds. We don't get hurricanes, but we can have from time to time high winds. And not only our coastal plain is subject to floods, but if in the riverine areas, you can get water coming from the mountains and the forested highlands. And in the Rupununi area, that's at the savannas out close to Brazil, in southwest Guyana, that area has 6 months of rainfall. So floods are very, very likely. But then the villages are spread out, far apart. So evacuation is important. Evacuation is very, very important. Getting people to places of safety. Because if you build the shelters on the coastal plain, it means that the very same areas will be flooded where the shelters are. So there is higher ground in this country, and plans have to be made to build shelters on the higher ground. And if you're going to do that, then they have to get boats and helicopters and so on to move people from that area of danger to an area where they will be safer. The shelters too, we got to think about accommodation. How are we accommodating this? Because somebody last speaker mentioned wheelchair ramps, proper bathroom facilities, markings for the visually impaired, and so on. So these things could mitigate against how people with disabilities are really, really taken care of. And of course, with the whole disaster relief business, It must be given, whatever relief is available, must be given to the people who are most in need, unhindered by political, religious, or any other forms of discrimination. Now, what worked? Well, we have people from the National Commission on Disabilities who are represented, or who represent the cause of people with disabilities. They sit on the Civil Defense Commission. That is the group that has to do with planning for this whole resilience and so on. But what we find is that they might make suggestions, but when it comes to implementation of the suggestions that that group would make, that becomes a problem, because money is always the underlying factor. There's where the excuse will be put. But we have representatives there. Another thing is that there is a National Commission on Disabilities, of which I'm a part. There is a National Disabilities Act. But what is needed there is the legal framework to give the act clause and teeth. In other words, to make the act more effective. People could be called to bar should they flout what was represented in the act. So we need the legal framework. In the COVID situation, we found that distributing relief to the vulnerable, the people with disabilities, it was not totally, we say 100%, and it wouldn't be 100% in any country. But at least we found that linking with the Disability People's Network and the organization, that was very, very helpful, because these people will know where the persons are. And so we were involved in several distributions, and at least the people that are on the list of disabilities from the organization, they were effectively served. But of course, we also know that there were some people who were not listed. Now, to that extent, there is currently in Guyana a survey going on. In fact, 50% of the country has already been surveyed to find the persons who have disabilities, where they are located, where they are located, and the nature of the disabilities that they have. So this kind of information will be very, very relevant, not only in government planning, but also in granting disaster relief when that is necessary. So I hope that would have answered some of the two questions that would have been asked. If any further information is needed, I am willing to do that. It must be noted, though, that on the National Commission on Disabilities, you have representatives from education, from labor, from health, from foreign affairs, and so on, that comprise. So the communication is there. And efforts have been made to have advocacy in these various government ministries. I think I would conclude my talk there. If any more information is needed, I will try to provide.
Many, many thanks, Colin. Great remarks. So before we go to any questions from the audience, I just wanted to invite the panelists, as well as Dr. Anderson-Barry and Maria Elena, if you have any other points you wanted to flag after hearing others speak, please do come in. Or anything you forgot to say. Sometimes that happens too. Liz, please.
Yeah, thanks so much, Zoe. And I really appreciate the contributions from the other members of the panel. And it's also a learning conversation for me at SEDEMA. And I wanted to touch on the point related to how we can leverage shock responsive social protection systems for and take into account persons with disabilities, because I know Michelle in her contribution had talked about identifying these specific spaces where persons exist, and notwithstanding where I sit as the head of SEDEMA, I'm also a member of my local district emergency organization in my parish here in Barbados. And I find it is a very useful, it's useful to connect those two things, because when you work at the regional level, I think you can work better when you understand what the issues are on the ground. And so our organization, for example, undertook a mapping exercise of vulnerable persons in the community. And this is something that I think is very important to do that. And it was really a group of us going around from house to house, trying to understand who was within that household. Were there persons who were persons living with disabilities, elderly persons, other persons that you needed to consider, et cetera. So I wanted to just sort of make that point that what I see the need for is a better connection between those types of actions that are happening by community disaster management organizations and the conversations that are happening at the national level. And from the SEDEMA perspective, the role that I see us playing is that we can do a bit more in terms of strengthening the policy approach and also standardized guidelines. So I really appreciated that conversation and what came forward from Colin's contribution and Michelle's, because that has, I think, pointed in some particular directions that SEDEMA can work a little bit more in. And we do have a space now where we're going to be convening a range of entities in the region who are working on shock responsive social protection interventions. And that can be an opportunity as well for moving this issue forward. So I wanted to just say thanks to the panelists, because that has assisted me as well. And I appreciate it. Over.
Many thanks, Liz. Not sure anybody else has any other points to add. If not, I did see in the chat, we're going to focus on questions specific to the report and to the panelists. So there were questions also around, of course, issues of accessibility to shelters going beyond just ramps, which I think were one aspect mentioned. So if anybody wants to come in on, universal design standards and other aspects that are being used for shelter construction to make them accessible would be great. If anybody wants to comment on that question, or maybe Michelle, since that was something that you had flagged in your comments as well, specific to St. Vincent and the Grenadines. Linda?
Just a couple of points. I'll start with the accessibility to shelters. It's very common to think that just putting in a ramp will help accessibility, but it's actually more than that. People have to be able to arrive at the shelter, and they have to be able to use the shelters when they get in there. There has to be facilities that, toilet facilities, washroom facilities, space that people with disabilities can use. I saw examples of buildings that had been adapted and were being used for shelters that, apart from being in flood zones, had toilet facilities on the first floor and only stairs to get up to the first floor. So although you can get into the building and maybe the doorways are wide, they're not effective to be used. They're not fully accessible for people who need to use them for any period of time. The other point I wanted to make, and I think it gets back to Liz's comments, is that I think it's helpful to come to your thoughts and your discussions about developing policy or looking at developing practices for working with people with disabilities from a perspective of how can we, what do you need us to do to help you do this, not what can we do for you. And it's what Neil said in the beginning, planning for rather than with. And it seems subtle, but I think it's really important, because there's a real tendency and a real drive, I think, amongst emergency managers to provide a safe environment for people with disabilities. So they will do this for this group of people rather than we will help them to be able to do this for themselves. And I think it's really important to come into the planning with that perspective. I think you'll only get that through deeply engaging and working meaningfully with the community of people with disabilities or their representatives. Did I answer the question about accessibility well enough? Sorry.
Yeah, I mean, there are other questions coming through the chat. So maybe Linda, if you want to take a look at those and respond on, for people who may have autism, or there are many different, as we talked about already, disability is not one. Everybody has different needs. And so it would be good maybe perhaps in the chat if you could answer a bit more. I think the person was asking for more detail on that. So maybe with that, I see Andrew Sharp has his hand up. Andrew, would you like to introduce yourself quickly?
Hi, how you doing? This is Andrew Sharp. What a great discussion. I'm so glad that I'm here and hearing from my regional partner about the very vital stuff that I advocate and always promote in terms of persons with disability. I have two questions. Working with the region in terms of training, that is vital for us to implement training in all different sectors. And that's some of the work that we are currently doing with some of EAL, and I know we've been doing with SVG. What we're seeing though is, will there be a regional data? I know Mr. Collin, you spoke about data. What we've been finding, especially as an organization from the diaspora, the fragmentation of data, and also in terms of the deaf community and the physical disability community, there is a disconnect with those two groups that we have found working on the ground with some of the local organizations. So are there plans in terms of a regional data? Or if there are regional data, how do we? And then the next question, how can we in the diaspora support, like for instance, my organization, to be able to support some of training, infrastructure, provide support for this community, which we have been doing, but we would love to give much, much more support. Thank you.
Thanks, Andrew. Does anyone from the panel want to come in?
Yes, the idea of having coordinated data across the Caribbean is a very, very good concept. But some of the Caribbean countries are now in the process of getting up that data. I know, as I mentioned, Guyana would have finished 50%, and we are going to take on actually the largest of the 10 regions, that is Region 4, that includes the capital. But I think the coordination of data would be very, very important. And as I mentioned, even though the group of people with disabilities could be marginalized and are marginalized and could be disadvantaged, there are some in the group, a subset of that group, that will be even more marginalized. And I mentioned those with psychosocial problems, people who are intellectually challenged, and the deaf community, because a large section of the country doesn't really know sign language so as to communicate and to keep these persons involved. Even when we talk about the shelters, the caregivers there, the ones who would be facilitating the process, also need to be trained on how to interface with persons with disabilities so that their work, their communication and everything could be far more effective. So with reference to the diaspora helping, because all the Caribbean countries depend on help from the diaspora in one way or the other. Training is very, very important. Building capacity. You know, some of the groups need capacity building in accounting, you know, record keeping and that kind of stuff. So training and capacity building, and we could interface by trading ideas about best practices in the developed countries. Even we know for a fact that they would have far more resources at they will access far more resources, but best practices, definitely that would benefit the entire Caribbean community.
Great, thank you, Colin. So Maria Elena, also from the panel, if you'd like to come in briefly. We only can take another question or so. We're running a bit out of time.
Thank you, Zoe. Just to add on, I think on the question on data. So I think there's a few things that the bank is currently doing in terms of first the training on disability disaggregated data that we're happy to as well put. This is led by our global disability advisor, so we can put that on the chat. But I think going back to the report, it really has very specific and concrete recommendations that I think now it's the next stage of seeing how this could be incorporated at the project level. And also just thinking, and I think Phil Crahan was mentioning that in terms of what are the next steps on how are the bank supporting this disability data collection. So also just to emphasize that as part of the commitments that the bank has done for disability inclusion, there's two aspects. One, on ensuring accessibility of post-disaster facilities, so the accessibility of those, but also considering things related to accessibility of, data disaggregation and following the Washington group. And I think on Maureen's question, on Maureen Weber's question regarding how do we think of people with sensorial disabilities? And I think it goes back to another key recommendation of the report that Dr. Anderson marked, that is not doing solutions for persons with disabilities, but also thinking about working with persons with disabilities. So in this case, we'll be working with organizations of persons with disabilities, and in this specific case that was mentioned, with the family, and trying to come up with solutions. And I think it goes back as well to raising awareness of the importance of inclusion and removal of stigma. That's again another important part of the report. Thank you, Zoe.
Thank you, Maria Elena. And then last, I think Beverly, you had your hand up first. Beverly Pyle, if you'd like to come in, please, and then we'll wrap up.
Good morning, Beverly Pyle, National Commission on Disability, Executive Secretary. Going back to the whole issue of what we were talking about a little earlier in terms of universal access, I want to make a specific point in terms of information sharing. Many a times we look at the physical, the ramp and the washrooms, etc. But then we have a serious situation where persons with disabilities do not get important information over to them in terms of understanding. Say, let's talk about a specific program, a special national program is coming over, going on, things are happening, but persons with disabilities are left behind because they did not get the information. For example, let's talk about even disaster risk management information. The way the information is brought over, lots of the persons with disabilities do not get it. So I figure we should be concentrating on the sharing of information for persons with disabilities as part of our universal access. Thank you very much.
Great. No, thank you. So with that, and hopefully the link to the report now is in the chat. We've put it in a couple times for people who have asked about that. So our time has come to close. I really want to thank the panel, Dr. Anderson-Barry, Maria Elena, everyone and of course the audience for your active participation. I think this topic is so important. And I think that this is something, it's a core part, at least, of GFDR's strategy, the bank's 10 commitments on disability as well, and how we do our work and how we can do better, of course. And in terms of GFDR, our strategy, what we're trying to do is mainstream approaches both to gender equality and disability inclusion across our entire grant portfolio, which then, of course, has a knock-on impact to the bank's lending and policy dialogue. And so for us, it's also very important. And we're continuously learning, and I think that's what we heard today. So, what are going from policy to action? And so, people's best interests may be there, but in terms of behavioral change, social stigma, and then really making champions who can make the effort to see and affect change on the ground, to make sure that persons with disabilities have voice, that they are included, and they're not seen as, people who can't do anything for themselves, that they have an active role and participation in these programs. And so hearing some of these lessons and this experience, and also from all of you in the audience, I think it helps us all with these lessons figure out how going forward we can do better and build on that work and take this agenda forward. And especially through the report and the findings and recommendations, how to make them living right on the ground. So again, I want to thank you all, and be safe, stay well, and we hope to see you again soon in other fora of this type. So take care. Thanks, everybody. Have a good day.